Hello everyone, and thanks for joining me today. Let me ask you something. Have you ever found yourself doing all the right things? You're trying to stay hydrated. Maybe you're doing some gentle stretches. You're watching your diet. But you're still getting ambushed by those awful leg cramps, especially at night. You wake up, your calf is in a knot, or your foot is just screaming, and you're left wondering, what on earth am I doing wrong? Or what else could possibly be causing this? It can be incredibly frustrating, can't it? You feel like you're trying your best, but those painful cramps just keep showing up uninvited. Well, what if I told you there might be a hidden culprit? Something many of us might not even think about when it comes to leg cramps. Something that's actually intended to help us stay healthy, but could, for some folks, have this unwelcome side effect. I'm talking about our medications. Now, medications are lifesavers. There's no doubt about that. They help us manage chronic conditions, keep us healthier for longer, and improve our quality of life. But as with anything we put into our bodies, they can sometimes come with side effects, and for a surprising number of common medications, leg cramps can be one of them. This is especially important for us as we get a bit older, because many of us might be taking one or more prescription medications to manage different health concerns, and sometimes the very thing that's helping your heart, or your cholesterol, or your breathing might be quietly contributing to those painful leg spasms. It's a bit of a puzzle, and it's not always straightforward. So, in today's video, we're going to pull back the curtain on this hidden connection. We'll explore some common types of medications that are often prescribed to seniors that have been linked to leg cramps. We'll try to understand why these medications might cause cramps, what's going on in our bodies, and most importantly, we'll talk about what you can do if you suspect your medication might be playing a role, and how to have that important conversation with your doctor. Because knowledge is power, and understanding this connection can be a really important step towards finding relief and feeling better. It's not about stopping your medications, absolutely not, but about being informed and working with your doctor to find the best solutions for you. Now, before we dive into specific medications, it's really important for me to say this loud and clear. Never, ever stop taking a prescribed medication or change your dosage without talking to your doctor first. The information we're sharing today is for educational purposes, to help you be a more informed patient, and to give you some things to discuss with your healthcare provider. Your doctor knows your full medical history and is the only one qualified to make decisions about your prescriptions, okay? That's super important. With that said, let's start by looking at one very common group of medications that can sometimes be linked to leg cramps: diuretics. You might know these as water pills. Doctors prescribe diuretics for a variety of reasons, often for high blood pressure or to help reduce fluid buildup if you have a condition like heart failure. And they do a great job at that by helping your kidneys remove excess salt and water from your body. But here's the thing. As diuretics help flush out that extra water and sodium, they can sometimes also cause your body to lose other important minerals, things we call electrolytes. Think of electrolytes like magnesium, potassium, and calcium. These minerals play a crucial role in how our muscles function, including how they contract and relax. If the levels of these electrolytes get out of balance, if they drop too low, it can make your muscles more irritable and more prone to cramping. It's like trying to run a car engine without enough oil, or the right kind of oil. Things just don't work as smoothly. So, if you're taking a diuretic and you've started experiencing more leg cramps, it's definitely worth mentioning to your doctor. They might want to check your electrolyte levels with a simple blood test. Sometimes, dietary changes can help, or in some cases, Your doctor might consider adjusting your medication or even prescribing a supplement if your levels are significantly low. But again, this needs to be under their guidance. Don't just start taking potassium or magnesium supplements on your own, because too much can also be a problem. It's all about finding that right balance. Another very widely prescribed group of medications that has been associated with muscle problems, including cramps, in some individuals, are statins. Statins are wonderful drugs used to lower cholesterol levels, and they play a huge role in preventing heart attacks and strokes. Millions of people take them and do very well. However, a certain percentage of people who take statins can experience muscle-related side effects, ranging from mild muscle aches and weakness to, yes, those painful leg cramps. The exact way statins might cause muscle issues isn't fully understood, and it doesn't happen to everyone. Far from it. But it's thought that they might interfere with a substance in muscle cells that's important for energy production, or perhaps have other effects on muscle fibers. The risk might be a bit higher with certain types of statins, or at higher doses, or if you're taking other medications that can interact with them. So, if you're on a statin and you've noticed new or worsening leg cramps or muscle pain since you started it, or since your dose was increased, that's a conversation to have with your doctor. It's important not to just stop your statin, because the benefits for your heart health are usually very significant. But your doctor needs to know about these side effects. They might be able to switch you to a different statin, as some people tolerate one better than another, or they might explore other options or look for other contributing factors. The key is open communication. They can't help if they don't know what you're experiencing. It's quite a lot to think about, isn't it? That the very medications designed to keep us well could also be the source of such discomfort. But understanding these potential links is the first step. We've touched on diuretics and their impact on electrolytes, and statins with their potential muscle-related side effects. These are two big categories, but they're not the only ones. So, we've talked about diuretics and statins, two very common types of medications that many of us might be familiar with, and how they could, in some cases, be linked to those unwelcome leg cramps. But the list doesn't quite end there. There are a few other categories of medications that are worth being aware of, especially if you've been scratching your head, wondering about the cause of your own leg pain. Let's consider medications used to treat asthma or other lung conditions like COPD. Some of these, particularly a group called beta-agonists, these are often found in inhalers that help open up your airways, can occasionally cause muscle cramps. As a side effect in some people, these medications work by relaxing the muscles around your airways, which is wonderful for breathing, but they can sometimes have a broader effect on other muscles in the body or potentially affect electrolyte balance, similar to what we discussed with diuretics. It's not one of the most common side effects, and the benefits of these medications for breathing are, of course, incredibly important. But if you use these types of inhalers regularly and you're also experiencing persistent leg cramps, it's another piece of information that could be useful for your doctor to have as they look at the whole picture of your health and symptoms. They might consider if the timing of your cramps correlates with your medication use, or if there are other factors at play. Again, it's not about blaming the medication outright, but about being aware of possibilities. Now, here's another area that might surprise some people. Certain medications used to treat Alzheimer's disease or other forms of dementia. Some of these drugs, specifically a class called cholinesterase inhibitors, work by increasing the levels of a chemical messenger in the brain called acetylcholine. This can help with memory and thinking. However, acetylcholine is also involved in muscle contraction throughout the body. So, By increasing its levels, there's a theoretical possibility that these medications could sometimes lead to increased muscle activity or excitability, which might manifest as cramps in some individuals. This is a more complex area, and the link isn't always clear-cut, as people with dementia may also have other health conditions or mobility issues that could contribute to cramps. But it has been reported as a possible side effect. If you or a loved one is taking medication for Alzheimer's and experiencing troublesome leg cramps, it's certainly worth discussing with the doctor managing their care. They can assess if there might be a connection or if other causes are more likely. It's all part of that careful detective work that good healthcare involves. And it's not just prescription medications. Sometimes, even over-the-counter drugs or supplements, if taken in certain ways or in combination with other things, could play a role, though this is less common as a direct cause of severe, persistent cramps. The main focus for our discussion today is really on those prescribed medications that people often take long-term. So, why do these different medications, from water pills to cholesterol drugs to asthma inhalers, sometimes lead to leg cramps? We've touched on a few mechanisms. A big one, as we saw with diuretics, is electrolyte imbalance. When your body loses too much potassium, magnesium, or calcium, or if the balance between them is off, your nerves and muscles just can't communicate and function properly. Nerves can become overly excitable, sending too many signals to the muscles, or the muscles themselves might be more prone to spasming. Think of it like faulty wiring in a house. You might get flickering lights or appliances that don't work right. Another way medications can contribute is by directly affecting muscle tissue. We talked about this a bit with statins, where they might interfere with energy production within muscle cells or cause some low-grade muscle damage in susceptible individuals. If muscle cells aren't getting the energy they need, or if they're slightly damaged, they can become more prone to cramping. Sometimes, medications can affect blood flow. If a medication, for whatever reason, slightly constricts blood vessels or alters circulation in the smaller vessels that supply your muscles, those muscles might not get enough oxygen and nutrients, especially during activity or even at rest. And a muscle that's starved for oxygen is an unhappy muscle, often a cramping muscle. And as we mentioned with some of the Alzheimer's medications, drugs can also influence the neurotransmitters, those chemical messengers that control muscle contraction. If the signals telling muscles to contract are too strong, or if the signals telling them to relax are too weak, you can end up with cramps. It's important to remember that not everyone who takes these medications will experience leg cramps. Many people take them for years with no problems at all. We're all individuals, and how our bodies react to medications can vary a lot based on our genetics, our overall health, other medications we're taking, and even our diet and lifestyle. That's why it's not a one-size-fits-all situation. But being aware of these potential links empowers you. If you start a new medication, or if your doctor changes the dose of an existing one, and then you notice new or worsening leg cramps, you can think, I wonder if there could be a connection here. This awareness is the first crucial step. It's not about self-diagnosing or panicking. It's about collecting information, observing your own body, and then having a productive conversation with your doctor. They are the ones who can put all the pieces of your personal health puzzle together. So, we've looked at a few more specific types of medications and explored some of the general ways these drugs might, in some people, contribute to those painful leg cramps. It's clear that the relationship between medications and muscle function can be quite intricate. It truly is fascinating and sometimes a bit complex how these medications that do so much good can also have these unintended effects on our muscles. So now we come to the most important part. What do you actually do if you suspect that a medication you're taking might be contributing to your painful leg cramps? This is where being proactive and communicative really comes into play. The very first and most crucial step is to talk to your doctor. I know I've said this before, but it bears repeating because it's so important. Please, do not make any changes to your medications on your own. Don't stop taking them. Don't reduce the dose. Don't skip days. Many of these medications are managing serious health conditions, and stopping them abruptly could have significant negative consequences for your health. So, schedule an appointment or bring it up at your next regular visit. Before you go, it can be really helpful to do a little bit of homework. Try to keep a simple cramp diary for a week or two. Note down when your cramps happen. Is it mostly at night, during or after activity? Note how severe they are, what part of your leg is affected, and how long they last. Also, make a list of all your current medications, including the name, the dosage, and how long you've been taking each one. Include any over-the-counter drugs, vitamins, or herbal supplements you take as well, as these can sometimes interact. When you talk to your doctor, present this information clearly. You could say something like, "Doctor, I've been experiencing a lot of leg cramps lately, and I was wondering if any of my medications could be contributing to them. I started noticing them more around the time I began taking medication name, or when the dose of medication name was increased." Having specific details can be incredibly helpful for your doctor as they try to figure out what might be going on. Your doctor will likely ask you more questions. They'll consider your overall health, the specific medications you're on, and the timing of your symptoms. They might want to run some tests, perhaps to check your kidney function or your electrolyte levels, as we discussed earlier, especially if you're on a diuretic. If your doctor suspects that a medication is indeed a factor, there are several things they might consider. One possibility is adjusting the dosage. Sometimes a lower dose of the same medication might still provide the therapeutic benefit you need, but with fewer side effects. This isn't always possible, but it's something they might explore. Another option could be to switch you to a different medication in the same class, or even a different class of drug altogether that can treat your condition but is less likely to cause leg cramps for you. For example, if one type of statin is causing muscle problems, another type might be better tolerated. Or there might be alternative approaches to managing your cholesterol that could be considered. This often involves a bit of trial and error, but your doctor can guide you through this process. In some situations, particularly if a medication is causing an electrolyte imbalance, your doctor might recommend dietary changes to increase your intake of certain minerals, or they might prescribe a supplement, like potassium or magnesium. But again, this should only be done under medical supervision, because as we've said, getting too much of these minerals can also be harmful. It's all about careful balance, guided by your doctor's assessment and possibly blood tests. Sometimes, the solution might not be about changing the medication itself, but about managing the side effect in other ways, such as ensuring you're well hydrated, doing gentle stretches, like we've talked about in other videos, or making sure your diet is rich in muscle-friendly nutrients. Your doctor might also want to rule out other potential causes of leg cramps, because it's not always the medication. It could be dehydration, overexertion, or an underlying medical condition that we haven't yet identified. The key is to have an open, honest conversation and to see your doctor as your partner in this. They want you to feel well, and they want your treatment plan to be as effective and as comfortable as possible. Don't ever feel like you're bothering them by bringing up a side effect like leg cramps, it's important information for them to have. So, let's just quickly recap the main takeaways from our discussion today. We've learned that yes, there can indeed be a hidden connection between some common medications and those painful leg cramps that can plague us. We talked about diuretics potentially affecting electrolyte balance, statins sometimes causing muscle-related issues, and even some asthma and Alzheimer's medications having a possible link for some individuals. The why can involve electrolyte imbalances, direct effects on muscle tissue, changes in blood flow, or influences on nerve signals to the muscles. And most importantly, we talked about the crucial step of not self-diagnosing or stopping your medications, but instead preparing yourself with information and having a thorough discussion with your doctor. They have various strategies they can consider, from adjusting dosages, switching medications, to addressing nutritional factors, all to help you find relief while still effectively managing your underlying health conditions. It really comes down to being an informed and engaged patient. Understanding that your medications could be a factor in your leg cramps gives you another avenue to explore with your healthcare provider. It's not about finding blame, but about finding solutions. I sincerely hope this information has been enlightening and empowering for you. Living with persistent leg cramps can really impact your daily life and your sleep. And knowing there are potential connections to explore and conversations to be had with your doctor can offer a sense of hope. Have you ever suspected a medication might be causing your leg cramps? Or have you had a conversation with your doctor about this topic? I'd be very interested to hear about your experiences or any insights you might have. Please feel free to share in the comments below. Your story could be helpful to others. If you found value in today's video, please give it a thumbs up. And if you're new here, consider subscribing to the channel and clicking that notification bell so you don't miss out on more health information designed to help us all live well, especially as we navigate our senior years. Thank you so much for your time and attention today. Remember, you are your own best advocate when it comes to your health. Stay informed, stay communicative with your doctor, and here's to fewer cramps and more comfortable days ahead. Take care, and I'll see you next time.